What does it mean to be mad? If negativity underlies the diseased psyche, then perhaps we are all mad. For negativity is the ontological force behind the process of mind. For Hegel, madness has a specific meaning, primarily associated with extreme forms of mental illness, such as insanity and clinical depression. Yet there is an interconnected thread of negativity that conjoins psyche in both health and madness. Insofar that psyche suffers, such as in the despair of unhappy consciousness, we are all neurotic. That is, we're all maimed by anxiety and pain to some degree. And this can lead to inversion and withdrawal into disordered thinking, to psychosis and melancholia. There is an aggressivity to madness, to the disordered mind. It underlies our being angry, hence mad, and also derangement, mania, frenzy, and the frantic confusion and agitation of the fool who lacks restraint and reason in his folly, is no more rational than a rabid animal afflicted by the craze of an infection or an frightened child. These are the categories Hegel ascribes to abnormal Geist, what modern psychiatry would label as forms of thought disorder. Hegel's philosophy of mind, or spirit, which is Geist, rests on a proper understanding of the ontology of the dialectic. Hegel refers to the unrest of Aufhebung, customarily translated as sublation, a dialectical process continuously annulled, preserved, and transmuted. Hegel's use of Aufhebung, a term he borrowed from Schiller, but also an ordinary German word, is to be distinguished from its purely negative function, whereby there is a complete canceling or drowning of the lower relation in the higher, to also encompass a preservative aspect. So unlike Fichte's meaning of the verb aufheben, defined as to eliminate, annihilate, abolish, or destroy, Hegel's designation signifies a threefold activity by which mental operations at once cancel or annul opposition, preserve or retain it, and surpass or elevate its previous shape to a higher, robust structure. This process of the dialectic underlies all operations of mind and is seen as the thrust behind world history and culture. It may be said that the dialectic is the essence of psychic life, for if it were to be removed, consciousness and unconscious structure would evaporate. Just in case you're not aware of this, Hegel never, ever said thesis, antithesis, synthesis. That is not him. He never wrote it. That would be, if anything, attributed to Fichte in his Wissenschaftslehre, where he talks about the acts of judgment. So that erroneous little phrase that's attributed to him, I just wanted to make sure that you're aware of that. For Hegel, the processes of madness may be said to be, one, the result of a fixation in feeling, what he attributes to the essence of the soul, leading to truncated ego development, what psychoanalytic object relations theorists would label as a form of developmental arrest. Or two, the result of regression back to the interiority of the feeling soul once ego differentiation has been achieved. Now, the feeling soul is the subject's, what he says, sentient totality, our initial embodied immediacy as a self-enclosed, undifferentiated universality, which remains, quote, the darkness of spirit, end quote, confined within a constricted inner world where the soul may regress back to after having achieved consciousness. So in Hegel's system, in the anthropology section of the Encyclopedia of the Philosophical Sciences, is where he talks about what the psyche is at first. It's soul, and it's specifically a feeling soul, and it relates to its own embodied nature. By the time you get to the phenomenology, the soul, the unconscious ego, has already breached into consciousness. So just a little context there. The life of feeling is where psyche may relapse to in a state of illness, according to Hegel, because it's in feeling that the subjective mind is first constituted, its original home. And whether this home be the oceanic feeling within the mother's womb, the instinctual attachment and dependency the infant has on her warmth, love, and nurturance, what Hegel calls, quote, the embodiment of the mother's inner affections, end quote, or the home of childhood that is imbued with idealized relations of being cared for and protected by family members. When psyche is confused, persecuted, or in pain, it evokes the feelings it once knew and would like to regather and re-experience in its affliction, a soothing wish for return to its lost unity. For Hegel, the formal, empty, undifferentiated unity of the feeling soul is the ontological condition of madness. Quote, as form, the life of feeling is a disease, end quote. The mind fixed in the soul's formalness is sequestered in a dark universality, contentless, abandoned to an empty immediacy. Now, in normal development, the soul moves beyond this empty immediacy, but in abnormality, it is either developmentally retarded, such as in autism or psychosis, or it slips back to its archaic existence in these early primitive feeling states from the more advanced stages of spirit's progression. This latter appearance is the most common path of illness. The logical movement of the dialectic is suspended in a fixation and or regression to the form of feeling where it becomes paralyzed. Not in the sense that it's totally immobile, but checked or limited, oscillating between empty and disturbed presentations. The separation of what is soul-like from objective consciousness is the form that underlines all types of illness for Hegel, what we may refer to as a psychotic core. But it's also the very bosom of our being. This is why Hegel assigns all attributes of character, ethics, disposition, and religiosity to the soul. He also sees conflict there, which is maintained in an unconscious manner and is not entirely accessible to consciousness. Withdrawal, regression, and fixation to the monadic symbiotic state of undifferentiated feeling constitutes the psychotic core of unconscious spirit. As a self-enclosed autism, the feeling soul is dissociated from understanding consciousness and objective external reality, which it has forsaken for the self-certainty of its black universe. In fact, Hegel sees derangement as a necessary stage in the development of spirit that the feeling soul must pass over on its ascendance toward ego mastery and control. The division within the soul that executes externality constitutes the loss of freedom and mastery. When enslaved in the night of the mind, the heart of darkness, psyche is a psychotic organization that knows no negation, no boundaries between inner and outer, only the nothingness of its unitary, empty, immediate being. Lost in the pervasive universality of the abyss, the feeling soul lives an isolated and constricted existence. Therefore, the undifferentiated unity of the simple universality of feeling becomes the template that defines the general form of psychopathology in all its manifestations. Hegel addresses many forms of derangement, including his language, imbecility or idiocy, absent-mindedness, disappearance or the rambling mind, folly, and its forms of world weariness and melancholia, and finally, madness or insanity proper. In almost all of these categories of mental illness that Hegel addresses, he refers to some form of thought disorder or detachment from objective external reality and the abandonment of the rationally motivated sublation of mind. This is what constitutes the primary distinction between the neurotic anatomy of spirit and the psychotic disposition that defines madness. In this respect, we are not all mad because, despite the fact that the normal developmental progression of mind must first pass through a psychotic organization as feeling soul, the neurotic constitution that is inherently present in the psyche, such as in forms of anxiety, despair, and existential suffering, and having the freedom to disclose itself in many malleable forms of expression, is to be distinguished from madness by its constant relation to external reality, even if such relation is transmuted through the intellect or fantasy. The deranged mind, however, constricted to the mode of feeling, loses its grip on reason as ego functions erode due to fixations on inwardness. It is the ego's breach with external reality that constitutes madness. In derangement proper, the power of negativity becomes fixated in a retrograde, arrested position. Negation no longer serves a positive function in the greater scheme of dialectical progression. Any positivity belongs solely to the defensive functions derangement may serve. The deranged mind does not pursue or understand the rational connectedness of subjectivity and objectivity. Instead, it remains fastened to subjective presentations and, quote, unfulfillable wishes, end quote, that are at variance with actuality. While this can occur in normal consciousness, the difference lies in the distorted belief that what is subjectively present is objectively actual, despite the contrary evidence that refutes it. This constitutes thought disorder, or particularly delusion. Hegel remarkably describes a diagnostic technique that later became a common component to psychiatric evaluation known as the mental status exam, utilized to assess whether an individual meets the criterion for thought disorder. He states, and I quote, "When someone speaks in a deranged manner, one should always begin by reminding him of his overall situation, his concrete actuality. If, when he is brought to consider and to be aware of his objective context, he still fails to relinquish his false presentation or belief, there can be no doubt that he is in a state of derangement," end quote. This constitutes a negation or a denial of objective reality for the psychotic or for the psychical reality of the interior. In derangement, what is objectively external cannot be recognized as such. Here we can say that reality has been remolded and redesigned to fit the fantasy organizations that preoccupy one's subjective presentations. Now, Freud also tells us that psychosis is, quote, the disturbance in the relation between the ego and the external world, end quote. For Freud, neurosis and psychosis are the result of the ego's inability to function due to the pressures exerted upon it from its, quote, various ruling agencies, end quote. Here he's thinking of, I, it, id, For Hegel, the unconscious rules the subjective presentations that dominate the mad mind. The ego of consciousness is withdrawn back into the imaginative center of fantasy, which it reconstructs as its concrete reality. In Hegel's portrait of derangement, as in Freud's notion of psychosis, there is an absolute separation of the subjective from the objective. Hegel considers three main forms of derangement, with several subcategories characterizing the sick soul: imbecility, folly, and madness or insanity proper. In imbecility or idiocy, there is a complete state of self-absorption, often accompanied by natural physical deformities. It is what Hegel refers to as cretinism. Here Hegel speaking of a cretin as having a closed soul, often the result of a genetic condition that is incurable. From today's account, we might refer to this as a pervasive developmental disorder, like mental retardation, or an organic brain syndrome, or autism, such as those associated maybe with Down syndrome. But Hegel also attributes idiocy to factors possibly brought on by the individual himself, such as the consequence of what he calls frenzy and epilepsy and debauchery. These have different meanings now, but he further points to catatonic conditions where there is a complete suspension of bodily and mentally activity, such as those found in severe forms of schizophrenia. Now, Disappearance, the rambling mind, on the other hand, manifests itself as a distracted consciousness that cannot focus its attention upon any one thing. It's kind of like a modern-day ADHD or drug-induced hypomania or something. It's precisely the inability to affix attention and concentration that gives this set of symptoms a manic, pressured, and chaotic quality. The individual may be flooded with a deluge of excitations, presentations, and/or associations that constitute psychic fracture, splitting, lack of self-cohesion, and decay. It often accompanies florid psychotic symptoms associated with thought disorder, bipolar or manic depressive agitation, and the hyper-emotionality and restlessness of schizoaffective disorder. But the soul, while deranged, may still have the capacity to function in its environment, even though it possesses delusional propositional beliefs and attitudes. This is to say that the ego of consciousness is not so entirely inverted that it can't perform necessary cognitive operations and actions belonging to understanding consciousness, or to an understanding of consciousness, in order to function and survive in its external surroundings. When confronted with the demands of reality, the fool may, in his particular condition, still mobilize and organize his ego functions in order to adapt. Now, there are countless clinical examples that verify this phenomenon. Even the psychotic can have transient moments of lucidity where self-conscious ego awareness embraces objective reality. So, as a psychologist working at an inpatient psychiatric hospital decades ago, I met with an individual diagnosed with paranoid schizophrenia who was requested to undergo psychological testing for treatment planning purposes. Now, upon greeting the patient, he informed me that he could read my mind. "Oh, really?" I replied. "Tell me, if you can read my mind, what am I thinking now?" He looked at me suspiciously and said dryly, "I'm not going to tell you." And we both laughed out loud at the same time. So I remember that very, very vividly. Whether his delusional belief system was active or not, at that moment he was self-consciously aware of the demands placed upon him by an external agent. He, in fact, was very functional throughout the interview and performed adequate cognitive tasks and possessed appropriate social skills, despite a severely regressed and psychotic profile that emerged from the testing. In the whole battery, Rorschach, etc. Hegel describes that the main difference between fools lies in the multifariousness of their fixed presentations, or in other words, the objects of their fixation. This may take many variegated forms, such as the rigid dwelling on a particular experience, a fantasy, wish, disappointment, conflict, or an emotion. Two particular subcategories Hegel highlights are forms of depression, namely world weariness and melancholia. The person who has grown weary of the tribulations of life has a depleted capacity to cope with its continual hardships. As Hegel says, he lacks the ability to, quote, put up with it. Here, Hegel focuses on the role of fixation upon a particular feeling. That's his terms. And particularly on the fixed presentation of content in the mind. He uses this term presentation, not a representation, but what is presented to psyche. Or I should say that what the psyche presents to itself, but it could be seen as ego alien. Take for example, here's a former 18-year-old male patient who's hospitalized for the first time, suffering from clinical depression after undergoing a deep humiliation. Upon his first sexual encounter with a female cohort, she commented on the small size of his penis, which produced immediate impotency, both physically and psychically. The trauma to his narcissism was so great that he soon became hopelessly suicidal. During his stay in the hospital, this is when I met him, the patient was obsessed with reliving the details of the injury over and over again as a repetition compulsion. Unable to rid himself of this horrid introject he experienced as a fixed presentation in his mind. As his depression worsened, he wanted electroconvulsive therapy to remove the memory of the whole event. This is an example of what we may call a toxic introjective fixation, when shame is too humiliating for the psyche to bear and must be excised. Hegel specifically refers to melancholia. As the soul fixates on its emotional pain and misfortune, it gives rise to, quote, an uncontrollable impulse to suicide, end quote. In depression, liveliness is extinguished. But as Hegel says, there are endless varieties of folly, he uses this term for whatever reason, in which particular presentations or content stimulate interest and passion. Hegel points to examples of thought disorder, specifically delusions of grandeur, when someone professes to be a god or a king, as well as gross identity diffusion, when someone believes that he is, quote, a barley corn or a dog. In these cases, the fool is not able to distinguish between his fixed presentations and objective reality, and thus is unaware of this contradiction. But in insanity or madness proper, the third main form of mental disease, the deranged subject itself is aware of its contradictory nature and the disruption it experiences. The sick mind knows and intensely feels the contradiction between its subjective content and objectivity. It is painfully aware of its suffering. Cognizant of its discrepancies in the dual fragmentation of consciousness, the mad soul cannot rid itself of its fixed content. Subjective presentations haunt its thoughts obsessively, which the subject in turn attempts to actualize by distorting and making its content objective, although through imaginative delusions and fantasy, or it attempts to demolish what is genuinely actual. As Hegel puts it, if the person continually dwells upon the past, transforming it and keeping it alive, he becomes incapable of adjusting to the present. Madness may be brought about by extraneous circumstances, social unrest, misfortune, the actual decay of one's individual world, or, quote, a violent upheaval, creating world havoc, such as in times of war, producing mass hysteria and insanity. Hegel continues to describe the feelings of uneasiness as a, quote, torment, producing, quote, a deceitful, jealous, spiteful, and malicious attitude that can give way to fury and quote, mania for harming others, even murder. But what is of greatest significance is Hegel's consideration of the role of the drives, unbridled desire, unconscious conflict, and irrationality in madness. As for Hegel's cure for the deranged mind, he prescribes a brand of dialectical therapy to heal the wounds of spirit. He tells us, quote, there is, for example, the case of the Englishman who lost interest in everything, first in politics and then in his affairs and his family. He sat motionless, looking straight in front of him, said nothing for years on end, and exhibited a stupefaction which made it doubtful whether he knew his wife and children or not. He was cured by someone who dressed exactly as he did and sat in front of him, copying everything he did. This put the patient into a violent passion, which forced him to pay attention to what was about him and drove him permanently out of his state of self-absorption. Hegel gives another noteworthy example. Another person who considered himself to be dead remained motionless and refused to eat, recovered his understanding in the following manner. Someone else, pretending to share in his folly, placed him in a coffin and took him to a vault where there was another person also in a coffin who pretended at first to be dead. After the fool had been there for a while, however, the other person sat up and said how pleased he was to have company in death. Then he got up and ate the food he had by him, telling the astonished newcomer that he had been dead for some time and therefore knew how the dead went about things. The fool was taken in by this assurance, followed suit by eating and drinking, and was cured. Whether this is true, I don't know, but this is coming from Hegel. Now, in these instances, both individuals were brought back to recovery from the self-absorption and destructive pull of the unconscious. Even in madness, the dark forces of the unconscious may be superseded. But let us see how Hegel's theories stand up to modern scrutiny. At this point, I wish to turn our attention to a case of a 42-year-old epileptic gay man who had a 20-year history of chronic, unremitting, rapid cycling bipolar disorder. Cliff was raised in a strict religious Protestant household. Affection was never displayed, yet hard work was expected. He describes his early childhood life as replete with maternal necessities, but bereft of interpersonal warmth and love. His mother was a controlling, depriving woman who demanded strict conformity and would administer physical discipline by pinching and twisting his biceps or the skin under his arms until they turned black and blue. His father was a devaluing and volatile man who would deliver stern whippings with a belt strap during Cliff's early childhood that eventually turned into regular beatings with his fists from the age of 12 throughout Cliff's university years. Church was a regular event in order to keep up social appearances. So Cliff was brought up to observe his faith. But this was juxtaposed to his increasing realization that he was homosexual. thus causing immense psychic torment, depression, and suicidality associated to feelings that his sexual impulses were unnatural, immoral, and sinful. Cliff became sexually active in his early university years, then lived with a partner for the remainder of his academic studies. During this time, he was battered on a regular basis and was thrown from a 2-story balcony by his lover, who was a volatile alcoholic, thereby fracturing his hip and pelvis. Shortly after that, he began having sporadic twitching fits, followed by passing out, and would periodically wake up to discover himself in a cold bath. This pattern got progressively worse and developed into grand mal seizures. He simultaneously began to undergo significant changes in his mood and temperament, characterized by extreme fluctuations in affect, ranging from intense suicidal depression to disjointed feelings of euphoria. He was diagnosed with epilepsy and manic depression, as they called it then, during his early 20s, and had several subsequent hospitalizations due to his illness. Cliff had attempted suicide on numerous occasions and was once in a coma for 6 days following a heavy overdose during an alcoholic bender. On another occasion, he was found unconscious in a closet in his apartment, barely alive. His illness became so insidious that he had to go on medical disability, which he has remained on ever since. For over 20 years, he had been taking myriad medications for his seizures, mood, and anxiety symptoms to help stabilize his condition, but he was largely treatment resistant. He even had a series of right unilateral ECT treatments, but with minimal success. Cliff had been actively yet intermittently manic, psychotic, suicidal, and medically unstable since I began seeing him in treatment. Therapy was constantly fraught with crisis. At one point, Cliff became paranoid and actively psychotic. One day he came to session palpably agitated with florid hallucinations, stating that they did not want him to speak to me any longer. Who are they? I asked. Bill and Fred. They're sitting right beside you. Bill and Fred were incarnations of previous lovers, one protective and one abusive. Each were dialectically at war with one another, projections of Cliff's divided self. Bill wanted him to fight, while Fred wanted him to die. Cliff was internally splintered, disoriented, and was fragmenting more by the day. His hallucinations and delusions persisted, despite a change in his medication regime. Then Cliff's psychosis gave way to unremitting paranoia and delusional persecution. People were watching him, following him, trying to poison his food, so he stayed cooped up for days, didn't eat or bathe, and neglected his dogs. Friends of his were on suicide watch. They took turns staying with him in order to get him through his night. Then one afternoon, Cliff called to tell me goodbye. I couldn't talk him down, nor could I get him to agree to come to see me or go to the ER. His hallucinations and feelings of persecution were simply unbearable. When he hung up the phone and would not answer when I attempted to return his call, I had no other choice than to call the police and have him committed to the hospital. While coming off of his manic psychosis, Cliff was criminally charged with theft and fraud. He claimed that he had no recollection of his activity and pursued criminal diversion under the mental health code rather than face a trial. During this time, his psychosis leveled into generalized paranoia and fear, and he preferred to seclude himself and avoid the world as a protective refuge. He dissociated through much of our sessions and was internally preoccupied with his hallucinatory experiences, refusing to accept them as delusional psychotic projections. He had constructed in his mind the presence of more benevolent protective figures to get him through the uncertainty of his impending court case. Then, bizarrely, He came to session in an angry demeanor, typically very meek, passive man. And he was talking in a different voice and under a different name. He appeared crazed and tough, unlike his more typically passive, meek, helpless comportment. Claiming to be another person named Hal, his alter ego he wished he could be, the patient explained that Cliff could not cope, so he was taking charge of things before Cliff killed himself. Hal told me that Cliff was charged with another count of defrauding a merchant and had to give a deposition to the police the next day. By the end of the session, Cliff had reconstituted, and Hal had disappeared. Cliff began to sob, but managed to gather his defenses enough to examine the practical tasks that were needed in order to cooperate with the lawyer and prepare for the criminal investigation that lay ahead. Cliff managed to evade prosecution of his charges. And over the next 2 years, we explored more directly his self-destructive path, his passive aggressiveness, and his failure to take personal responsibility for his life choices, his death wishes, and sadomasochistic need to suffer, his incessant complaints toward family members, and the self-sabotaging role he played, his fixation with loss and lack as a failure to mourn, his physical abuse and analytic deprivation during childhood, and his persistent oscillation between apathy and self-pity associated with unresolved trauma. Treatment with Cliff could be characterized as a protracted carnival ride, intense, turbulent, and abrupt, punctuated by moments of calm before the scream. Over this time period, Cliff was profoundly depressed, intermittently hypomanic, manic, psychotic, unpredictably suicidal, had disrupted his medication schedule several times, became detached, and grew increasingly more fragmented. When his alter ego returned, this time as another part self, it confessed again that Cliff had been lying to me. Unable to speak about it directly in the first person, he was afraid of losing me, and hence sheltered me from many things as a need to protect the specialness of our relationship, afraid I would abandon him if he were to be completely honest. Because of time, in the end, Cliff went to prison for writing bad checks after I had defended him in court. Ironically, he did not succeed in destroying himself. Prison offered the punishment he was unconsciously seeking. As a reparation for guilt, self-loathing, and the neutralization of his death drive. When he was released, he continued for one more year of treatment. Remarkably, his need for self-destruction had disappeared. What is equally remarkable is that Hegel wrote about our modern-day patient in 1817 and lectured on madness throughout his career. Despite Hegel's antiquated categories, the language of mental illness lives on in new terms under old forms of pathos, namely, to be human is to suffer.